Welcome to Motors in Medicine. On today's episode, I'm going to be discussing PRP injection or platelet-rich plasma. And before I get into that, I'm going to go over briefly the body's tissue's response to injury. And that'll help you understand platelet-rich plasma once we get into it. So when the body sustains an injury, whether it be to soft tissues, joints, cartilage, connective tissues, tendons, ligaments, etc. The body's response to that injury, whether it be a sprain, strain, partial tear, whatever it happens to be, is to flood the region with swelling. What that swelling contains, in general, is a collection of chemicals, for example, cytokines, chemokines, prostaglandins, things that perpetuate a healing response. And along with that chemical response, you get a lot of platelet activity going on in those tissues. Now, the reason for that is because contained within the platelets and the fluid that contains a lot of these chemicals are growth and reparative factors. And so initially, when the body is injured and you get swelling flooding an area of injury, the body is initially trying to perpetuate a healing response, okay? And sometimes that healing response is adequate for the nature of the injury. And sometimes the outcome is commensurate with the body's response. And you end up with a pretty decent healing response. You don't need any type of intervention of any kind, and you heal just fine and you regain function. However, there are conditions, and we'll go over a few of those that basically don't heal very well or are poor to heal. And when that situation arises, something like PRP or platelet-rich plasma becomes a viable option to help facilitate a better healing response. Now, let's get back into PRP or platelet-rich plasma. What is it? Well, platelet-rich plasma is basically a compound derived from your body's own natural blood supply. The way it's procured is blood is taken from the body in vials, special collection tubes, and then it is spun in a centrifuge at varying RPMs for varying amounts of time. And once that procedure is completed, you're left with a coat of plasma that contains a very rich amount of platelets. And like I said before, contained within that fluid and those platelets, growth and reparative factors, as well as the chemicals that perpetuate healing response. The collection is then done by retrieving or removing all of that platelet-rich plasma, put into syringes, and then injected into sites of injury. So we're going to first discuss a few typical sites of injury that could benefit from PRP, and then talk about why it may help work and help the healing response be facilitated a little bit more efficiently. So one particular site of injury could be the shoulder joint. The shoulder joint, because it's such a dynamic, free-range movement joint, one of the connective tissues inside the shoulder is called the labrum. And it can be stretched and injured in a number of ways, from either high velocity, pulling injuries, lifting injuries, stretching injuries, things like that, direct blunt trauma and such. And the labrum is kind of like a connective tissue cartilage. And one of the things that we see a lot of in the shoulders are what we call a slap tear. And that is where the top of the labrum on either the front or the back has been injured or partially torn and stretched beyond its normal capacity. And that causes instabilities in the shoulder. So I will give my personal experience. I actually had sustained a slap tear to both of my shoulders from various causes, anywhere from playing sports to lifting heavy weights, things like that in the past. The left shoulder, I chose to have surgery performed. And it was very painful, very difficult to endure. The rehab took well over a year, it was not a pleasant experience. So when I knew that I had a slap tear on my right shoulder, I thought, I'm going to try an alternative form of treatment. And in this case, I chose PRP, or platelet-rich plasma. I had a total of 4 injections done to my right shoulder. And over the course of a few weeks to a few months, lo and behold, I actually felt incredible response to that PRP. To the point that my right shoulder regained function, range of motion, and strength, and I was able to regain the ability to do things like lift weights, do chin-ups, things like that that I could not do before when my shoulder was torn. So that gave me good reason to start doing a little bit more research in PRP and using it as an adjunctive type therapy for a lot of my patients. And so I started doing that with a lot of my patients. And again, with my patients, I started to see quite a bit of a positive response from the injection of platelet-rich plasma into certain sites of injury to try to perpetuate a good healing response. Now, the way that PRP would initially work is that when you have a response to injury like we discussed, those connective tissues don't have the best circulation, if you want to say that. It's difficult for those compounds and for those growth and reparative factors to get into those sites of injury and work efficiently. So some doctor in the past, not sure how long ago this happened, decided that when you centrifuge blood in a certain process, in a certain way, and collect it the right way, you wind up with a very high concentration of platelets and plasma. And they thought, what could we use this for? And they started using it in various different applications in medicine, one of which was for tissue response to injury, to get it to heal faster, post-surgically and otherwise. And they started to notice that people would heal faster, one way or another. And they found that collections of this platelet-rich plasma, when they looked at it under a microscope, you had almost 100-fold increase of growth and reparative factors compared to just a standard tissue response to injury. And so by bypassing the limitations of circulation to certain joints, tissues, and connective tissues and other sorts, if you bypass that by injecting directly into the site of injury with this high concentration platelet-rich plasma, you then can basically perpetuate a much stronger, more robust healing response, and therefore the body can, in essence, heal itself at a much faster rate with much better outcome and better prognosis. So this is where it comes into play when you have these injuries now that are long-standing, or if they're just stubborn injuries, and I'll give you an example of that. Tennis elbow is something that's I've actually spoken of in the past in one of my previous videos. Tennis elbow, or lateral epicondylitis. Its cousin, medial epicondylitis, which is the other side of the elbow. Similar issue. You just get this overuse syndrome of a tendon. And no matter how much ibuprofen you take, or how much therapy, or how much medication, or even how many cortisone injections you receive, you still seem to continue to suffer from this condition. And I'm one of those people. There again, I thought, I'm going to try platelet-rich plasma, and I had my elbow injected, and sure enough, I have done far better than I did prior to when I just used things like cortisone or friction massage or other methods of treatment, which in some mild cases work just fine. But in my case, I had a recurrent long-standing case of tendinitis or lateral epicondylitis, and it just would not respond well. It would just not get better. So after having my elbow injected with platelet-rich plasma, I found that the response to injury was so much better, so much more profound, and my elbow healed to the point where I rarely, very seldom get any symptoms in my elbow, but I'm able to do things like chin-ups, which I could not do before, and certain types of lifts, pulls. Even examining patients was a little bit painful for my elbow. But now I don't have that issue anymore. So I have become a firm believer and an advocate of using platelet-rich plasma for the injection of certain types of injuries and tendons, joints, and ligaments and such. So basically what I'm trying to get at now is that if you happen to be suffering from a long-standing joint injury, or a tendonitis, or a cartilage, or even just a muscular injury that just doesn't seem to heal very well, you may want to give PRP a try. There are a lot of medical facilities that can provide that kind of service. I provide that kind of service where I work for my patients, and I've seen very good results with that type of treatment. And of course, alongside all the other management strategies for these joint injuries, rest ice and compression and NSAIDs and such, proper physical therapy, avoiding certain types of movements to avoid future injuries, those are all viable treatment options as well. What I'm trying to state now is that PRP is just another viable option, another tool for the tool belt to use if you are a provider. And if not, if you are a patient, consider that as an option for treatment. Hopefully this information was beneficial. Hopefully you guys who are suffering from these types of injuries may want to do some research and find out for yourselves if this is a possibility, if this is something you may want to try. I have personally used it. I use it on my patients, and I've seen some pretty good results. So like always, please like and subscribe. Hit the thumbs up button. Again, we'll get back into some more videos on the motor side, probably doing some more work on my Bronco. I've got some parts lying around that I need to install. We've got some pretty interesting things coming, so that should be pretty good videos coming up. So appreciate all your support, and until next time, this is Motors and Medicine signing off. Thanks.